I started out here as an associate doctor for my chiropractor. And when I took it over, it was probably 70% workers' comp PI, so it was acute pain care. And I started to turn it into my vision of a practice, which is a true health and wellness practice. I think the biggest problem we all have, especially as chiropractic, is we have a chiropractic practice and then we have a nutrition practice. They all worry that when they do nutrition is that they'll lose money because they'll lose chiropractic patients.
You know, they come in as a chiropractic patient, they start the nutrition, they're like, wow, I should have done this a long time ago.
So I suppose my specialty is whatever's coming in, we're going to look at all aspects of the health and things that most people don't look at, and we're going to give them the tools they need and the action steps they need so that it becomes a lifelong process for them. ZYTO is a tool that we utilize to help make good clinical decisions in here. We use that on every patient, every visit. It's helped me bridge that gap to show people why they need to do the nutrition with the chiropractic.
I'm kind of visual, so it's like I believe what you're saying, but having it in front of me helps, and having the chart and having a visual aid of here's a circle, let's try to get in this circle. It's really nice to have.
It's completing a picture of multiple tests so that when we sit down and say this is what you need, we know why you need it, we can scientifically back it up and explain what the program's going to do.
With the usage of the ZYTO machine, it seems that there is a more specific overall treatment plan, and that usage, when there's more documentation and more information, has been very effective in our overall protocol.
I was a little skeptical at first, but every time it's been right on, because what it shows in the graph is actually what I'm feeling.
This pinpoints the areas he needs to concentrate on.
I just think it's amazing. It's so fast and accurate, and it's not invasive. You're not taking blood, and you take a few minutes, and grab a person and put their hand on there, and just a quick evaluation, and you give them some supplements, and and they really notice a difference.
The staff does the ZYTO scans. There was very minimal learning curve, so a day or two they were running it without questions.
I think if the patients are more informed, they're going to talk about you more, and you're going to get the patient referrals in here because they're having positive results.
I didn't know what to do anymore, and a golfing friend of mine said, you got to go see Dr. Guess.
And I'm telling everybody, what kind of results I get. People want to know, are you okay? You've lost all this weight. And I said, yeah, I'm better than ever.
I definitely have recommended it to my friends to come down, and even just for the first visit, just to see what it's about.
I have 4 friends that are coming now because of me.
Well, I did send my brother down here, and I did send my husband down here.
Our goal in this office isn't just to help you get well. Our goal in this office is to educate you so that as you leave this office, you can make better health choices and that you thoroughly understand what we're doing and why we're doing it. And as a result of that, people can go out and easily explain what happened, why they're doing it, and the results they're getting. And because of that, they're giving me referrals without asking, because the results show the proof, but better yet, they can explain what's happening to them and why they're getting better.
I do a lot of gardening, and now I can go out there and work beside my 37-year-old daughter, just like keeping up with her and whatever. I couldn't have done that before.
Coming to Dr. Guess has really been a godsend, because I'm 27, I want to be 27. I don't want blood pressure and cholesterol of a 57-year-old, because that's what my dad is, and I don't want to be like him.
I'm the mother of twins that are 2, and I have a 6-year-old, and I'm working. So when we first got it, it was energy was my biggest issue. So it really helped me get on the right track with supplements to help me with that.
Once I bought into his program, it just started to go, come off pretty easily. And I'm not trying to lose any more weight. I just want to maintain what I have and leave this kind of lifestyle, and I feel better about it.
The information that I'm getting from the ZYTO machine, as I've seen it from a patient standpoint, is very accurate, just knowing what my own body has been using in terms of the supplements and how it's had its effect. Thus, the correlation of what the ZYTO machine reflects and how I'm feeling and what I have been taking is very consistent, which makes that much more of an adjunct to what I would even want in my own clinical practice.
I would highly recommend that any practitioner add ZYTO into their practice. I think it will only enhance and allow their practice to evolve in the direction that they're looking to evolve to.